coverage of the 2023 Southwest Beef Symposium at the Overton Hotel in Lubbock. We'll get started again with George Perry, Texas A&M AgriLife Research in Overton, what we've learned about IBR. Live coverage on the farm station, all ag, all day.
With a focus on implementation and outcomes at the ranch level. So it's our pleasure to have Dr. Perry here with us, at least through Zoom, for this year's program. And Dr. Perry, I'm gonna hand it over to you. He's gonna talk about some of their research discoveries with our IBR and IBR vaccines. George, it's all yours.
Morning. Thank you for the introduction. It's interesting. The title that was presented was what we've learned about IBR, and actually the way I would prefer to do that is to list, let me figure out why I'm not moving here, what I've learned about IBR and vaccination, because as been said, my training is actually in reproductive physiology. And so about 13 years ago, we started doing a bunch of work on how diseases can impact reproductive performance. And so I want to start with just a little bit of background so everybody's on the same page, mainly focusing on IBR. And IBR is actually a herpes virus. And so a lot of the things that go along with herpes viruses in humans is the same in cattle. And so you may have also heard IBR referred to as red nose. It gets that nickname because after 2 or 3 days of incubation, usually the mucosal area around the nose will become red, inflamed. And so it got that nickname. But there's also subclinical IBR where there's no outward signs, but you can still have negative consequences. And the way it spreads in your herd is nose to nose contact, genital to genital, or it can actually become aerosolized. And so during the breeding season, and with my interest on reproduction, every time the flamen response, you see a cow or a bull sniff another cow, they can actually get exposed that way. Now, as I mentioned, just like any other herpes virus, once an animal's infected, they're infected for life. And so if you know anybody who's ever had a cold sores, people who get them will get them their entire life. And because the virus actually establishes latency within the peripheral nervous system. And so in those nerves, that virus can actually live and hide out. And then just like a cold sore in people, if an animal becomes stressed, it can reactivate that virus. Now, what's interesting is the research that's been done on reactivating IBR. Of course, we can give injections or stuff to induce high levels of stress, to upregulate that whole pathway. And in doing so, we know it can be brought out of latency. What we don't know or have a good handle on is what level of stress is required to bring it out naturally. And if we think about that, even among all of you there, if we could spend all day talking about stress and how the body manages stress, but different animals and different people sense stress differently. And so that variation makes it hard to know what levels of stress there are. I mean, running a cow through a chute is going to cause stress. Trucking them will cause stress. But animals sense those levels of stress differently, and we don't know at what level is needed to bring it out of latency. My interest on it being on the reproductive side is mainly on what can happen during the breeding season. And I've got good friends that work in the pharmaceutical industry, and I point out to them, you know, in the pharmaceutical industry, we vaccinate the cow herd. That's a big sector of the beef industry. But why do we vaccinate a cow herd? We're not worried about average daily gain. We're not worried about the daily performance. We vaccinate a cow herd for reproductive reasons. We're trying to avoid embryonic loss, abortions, or delaying an animal from getting pregnant. And so that's really where I got interested into things, was having a lot of producers ask me, okay, when we're vaccinating animals, timing of the year, all of these different things that can impact things, what's going on? And so we know that IBR not only can cause abortions, but we know it can actually directly infect the reproductive tract. It can cause lesions in the corpus luteum. We can also get immune cells, the leukocytes, moving into areas and disrupting luteal function. And so what actually does it do? Well, if we look up here, this top picture shows a normal corpus luteum, and it's probably a little hard to see, but these big cells here are the large luteal cells, and they actually produce about 80% of the progesterone that's needed to maintain a pregnancy. When we look down here, what happens when an animal's infected with IBR, we can see necrotic tissues, we can see all these immune cells moving in to the ovary that can disrupt things. What about when we just vaccinate an animal? We actually see very similar things. Here's ovaries collected 9 days after vaccination. We can see all these immune cells that have moved into the ovary. We can see necrotic areas within a corpus luteum. And so with that, we know we're having negative consequences. And so if we go back in the literature and we look at what impacts can be had on reproduction, when live IBR was given to heifers the day after estrus, and I'm going to point out when in the estrus cycle these things are occurring, we see necrosis of the ovary in 7 of the 8 heifers. When it was given the day after estrus, this is a modified live, CL and ovarian necrosis in all 8 heifers. Modified live vaccine given to 18 heifers 4 days after a second prostaglandin. So peak estrus after 2 shots of prostaglandin should be about 60 hours. And so you're about a day or 2 after the onset of estrus. And we can see 14 of the 18 had inflammation, ovarian corpus luteum necrosis. Again, modified live, 19 heifers, day of the second prostaglandin, so before they showed estrus. Of the vaccinated heifers, only 3 of the 10 calved. In the control, all of them calved. So you can see it impacted reproductive performance. 14 days after breeding, infertility, embryonic death, and a return to estrus. And so we can see, but most of these studies have looked at things right around the time of estrus. What happens with other diseases too? Because when we go to vaccinate a herd, we don't give them a shot for IBR. It's a combination vaccine. And so that's really where we started jumping into things, was what vaccines we're using and what impact it can have. And there was some work done. Dr. Grooms did some work looking at a commercially available modified live vaccine, said BVD, IBR both in it, collected ovaries 10 days after vaccination. And what we can see here is, if you can see these pictures, these brown dots are actually immunohistochemistry, where they were actually able to find BVD antigen in the ovary. But what's interesting, for virus isolation, only 1 of their animals was positive, but in immunohistochemistry, we can see 5 of them were actually positive. So even with vaccinating with a combination vaccine, we have both thinking about IBR and BVD. With all the work that had been done, we know for some reason both of these viruses really like the dominant follicle. If you give a vaccine to a naive animal, you are going to disrupt the corpus luteum that follows that dominant follicle. And so the thought had always been, if we vaccinate an animal and there's a dominant follicle present, it's going to get into that follicle, mess it up, so then you disrupt that estrus cycle and things are good. That is actually where the label on all of our vaccines come from that say pre-breeding vaccinations, approximately 4 weeks, 28 days, approximately a month, depending on which vaccine you use, how it's worded, is because we knew it would impact here. So one of the things I started getting asked was, well, with current synchronization protocols, we don't worry about this dominant follicle because almost every synchronization protocol we recommend, we actually give an injection of gonadotropin releasing hormone, or GnRH, at the start of the protocol. And what does that injection do? It actually ovulates this follicle, so then we have a new follicular wave growing that is going to be the one that causes estrus when we remove a CEDAR or a progestin or at the end of the protocol. And so if the dogma was correct that all it does is impact this follicle, we shouldn't be impacting anything out here. And so that's really where we started getting into things. When we look at what we actually did, we took 59 heifers. We vaccinated them at the time that CEDARs went in, and we gave a shot of GnRH. When we looked, we had a high level have abnormal cycles. And so I want to step you through what we saw here. With our modified live vaccine, we had almost 40% of animals have an abnormal cycle. Even with a killed vaccine, if they got one dose at that time or if they had had 2 doses, so that would be a dose at the same time and a dose about 4 weeks earlier, we can still see 10 to 15% abnormal cycles. Our control animals, none of them had an abnormal cycle. So we can see just impacting the immune system can have negative consequences in naive animals. So what am I describing as an abnormal cycle? The green line here is actually what we normally see. So as progesterone increases, it comes up and stays throughout that cycle. If she doesn't get bred, then it regresses. So these red dots was the single dose of a modified live, and we can see a lot of them come up, but then they regress early. We can see here in the 2 inactivated treatments come up and regress early. Now, why is that important? If we synchronize and we breed an animal, and that corpus luteum regresses early, she doesn't know she's pregnant until about day 16 of the estrus cycle. So for those first 2 weeks, she doesn't know she's pregnant at all. And so when that corpus luteum regresses prior to day 16, there's no way for her to maintain a pregnancy. And so it doesn't matter if the oocyte was good, if the semen was good, if that CL regresses, we have negative consequences on reproductive performance. So let's look at the pregnancy rates. In the modified live vaccine, we ran a 30% pregnancy rate. And so when animals were vaccinated at the start of synchronization, we're given a shot of GnRH, so we know we turned over because we were ultrasounding them. That next follicular wave, we still had these negative consequences. Now, you may look here at our control and say, wow, 90% pregnancy rates. In this study, we did everything we could to get these animals pregnant. So they were AI'd twice, and bulls were turned out the next day. And so there was no chance of them not having semen present at the time of AI, or at time of ovulation. We can see there was not a statistical difference between our inactivated and our control group. Second service, because not all of the inactivated got pregnant, the few that didn't, we can see they bred the second service. What really surprised us is in the modified live vaccine, again, we were below 40% that conceived on that second service. So even though they short cycled, a bull was out there with them, we only had 40% of animals that bred to that second service. And so what did we really learn in this study? What did it really do to challenge some of the dogma that was out there? So we know from past studies that both IBR and BVD will impact this dominant follicle. We give this shot of GnRH to get rid of it. We have this next wave that's coming up. We know that in about 40% of the animals, we had an abnormal cycle. So we impacted luteal progesterone here because that CL regressed early. In those that it regressed early, because we were taking every other day blood samples, we know exactly when they returned to heat and everything else, we only had a 40% pregnancy rate out here. There's one other study that was done many years ago now that actually looked at vaccinating animals and said it took about 2 cycles for them to return to normal cyclicity. And so not only are we impacting what's going on right here when we do give a vaccine, but we're impacting all of these follicles out for roughly 2 cycles. When we look at what's going on, when early follicles start growing from this very first activation until the point of ovulation is about 90 days. From antrum formation to ovulation is 42 days. And so we see, at least from this study, where we're out here, we're impacting all of these growth after antrum formation. And so if we're looking at naive animals, and definition of naive is animals that have never been vaccinated before, we really need to stay away from modified lives near the beginning of the breeding season because we can have those negative consequences. Now, you might be thinking, are there naive heifers out there? Yes. I mean, and I can tell you several stories of herds we've gotten called into to help investigate of somebody was told, oh, they were given this vaccine. And in reality, they weren't. So I usually tell people, unless you gave it or your vet gives it, it was not given. And so we need to consider those animals as being naive. Now the question becomes, what about previously vaccinated animals? Do we have similar consequences? And when I was a graduate student, we talked about this frequently with some of the heifer development programs I was helping with and that. And we always went back to 2 studies. This first study was done by Dr. Stormshack in Kansas on a large herd. There's just shy of 300 heifers. They were vaccinated either 30 or 9 days prior to the start of the breeding season. If we look, estrus expression, no difference. AI pregnancy rates, no difference. Breeding season pregnancy rates, no difference. So from that, we would say, okay, there's not a difference. The second study, second dose, so they had gotten 3 doses of a modified live. The second dose 90 days prior to breeding. The third dose either 40 or 3 days prior to breeding. And if we look at this, conception rates, no difference of overall, first service, second service, days to conception are not statistically different. And so the conclusion that was always drawn was that there was no difference once these animals have been vaccinated. But as we think about these, and as we started looking into things more, what was actually tested in these 2 studies? What was getting tested was more of the timing of the vaccine. And we'll get back to that in a minute. But as we started looking into things, there were a couple of studies that were published comparing a modified live to an inactivated vaccine. Here's one that gave 40 and 10 days pre-breeding, 61 or 31 days pre-breeding. And if we look, between the modified live and the inactivated, there's a 20% difference and a 15% difference in breeding season pregnancy rates. Now, if you read the studies, they tell you there's no difference between these two treatments. And that is correct. There's not a statistical difference. Because when you look, there's 10 to 20 animals per treatment. And when we think about reproduction and we're measuring pregnancy, yes, no answers, it takes large numbers of animals to get a difference. Here's another more recent study that compared modified live to a saline, 20% difference. So now there's 3 different studies that have looked at, statistically there wasn't a difference in their studies, but they're kind of trending that way. And so we did a really large field trial. We worked with almost 1,500 cows and heifers, 9 herds over 2 different years. We blocked everything by age, previous calving date within herds. All females had been previously vaccinated with a modified live annually. All of these were on research stations. And so we tracked them to look at reproductive success, because our thought was, okay, if we're going to do this, we want enough animals to actually answer the question. So we did 3 treatments. We did a modified live vaccine, so it's a combination vaccine, IBR, BVD, PI3, BRSV, Vibrio, Lepto, we're all in there. A killed that covered the exact same, or they got saline. And they were vaccinated directly according to label. 30 days pre-breeding for the modified live, 30 and 60 days for the killed, because they had never seen this killed vaccine before. Or every time they went through the chute, if they didn't get a vaccine, they were given saline. So to draw that out, here's what the modified live looked at. At day minus 60, and all these cows were in the same pasture together, they got saline. At day minus 30, they were vaccinated. Then we started the synchronization protocol, all of them on the 7-day co-sync plus cedar. And then they were fixed time AI'd at the appropriate time if they were cows or heifers. The killed vaccine, they were vaccinated on day minus 60 and minus 30, then the exact same. This control group got saline both times, and then all the way through. So what did we actually see? Well, our first question was, okay, since there's large numbers and herds, how did the herds respond? And so we looked at it by the impact of days postpartum. And so we all should know that as a cow gets further postpartum, fertility is going to become better. She gets over uterine involution, she gets over the anestrus period, better nutrients, she's not supplying as much milk to the calf. And so we grouped these animals from heifers all the way out to 160 days postpartum. And we can see, as we get further postpartum, AI pregnancy rates increase. We also took a preg check at day 56. Why is this important? Well, at day 56 of the breeding season, we can ultrasound and we can determine AI pregnancies, and we can also determine pregnancies to the first bull breeding. And then, of course, after the breeding season. So let's look at our treatments here. So modified live, saline, killed vaccine. Modified live had a p-value of 0.055. So there was a 5.5% chance that this is lower due to random chance. But we can see here the saline was intermediate, and our killed vaccine actually had the highest pregnancy rates. When we get out here to day 56, so we're not just looking at the AI pregnancy, but the AI and the return estrus with the bull, we can see the modified live actually had significantly lower pregnancy rates, and they carried that all the way through the end of the breeding season. And so there was a lot of controversy over that study, a lot of people arguing whether what we saw was real or not, and a lot of debate over, okay, what vaccine is better? Because a lot of times people are told, I need to give a modified live vaccine, it gives better protection. So since I'm not there and I can't see anybody, usually I ask for people to raise their hand if they think a modified live or a killed vaccine actually gives better protection. And so be thinking to yourself, I'm sure you've heard different things, and there are definitely differences in how the vaccines work, but which one do you think gives better protection against IBR and BVD? This study was actually done a few years ago now to actually look at that. So they took heifers at weaning, and this was done at Auburn. Group A and B received a modified live vaccine. Group C received saline. Came in pre-breeding, and they were vaccinated again. So this is the weaning dose, pre-breeding dose. They had not been vaccinated before that. They were bred, preg checked. Out here the next year, and we can debate timing on things, but I'll explain why they did this. Group A received the same modified live. Group B then received a killed vaccine. This was actually the Cattle Master vaccine, so it's a killed BVD. It is a temperature sensitive IBR, so it will not replicate at body temperature. And Group C received saline again. They calved, they bred them again, and then they exposed them to a BVD PI challenge. They were on an annual vaccination, and so the timing is what they were looking at here, is so these were actually exposed to BVD almost a year after vaccination. They were vaccinated, same thing, modified live, killed vaccine, saline, and then they were exposed to an IBR challenge. And through all of this, they measured any abortions and all of the calves that were born alive. And so what did they actually find out? This graph can get a little busy, but percent aborted. So this is to BVD. We can see that Group A, the modified live group, 13% of animals aborted overall, 9% of the fetuses or calves were positive for BVD. And so we can see the A's are abortions. This is the red are ones that are positive. In Group B, the ones that started on a modified live and then switched to a killed vaccine, one animal aborted, none of them were positive for BVD. The control group that got saline, 73% of the animals aborted, 93% of the calves and fetuses were positive for BVD. What about IBR? It's the same percentages for abortions. We can see 2, again, positive for bovine herpes virus or IBR, but it's a different 2 fetuses. Same numbers for the killed. For the saline group, we can see 8 of the 15 were positive for IBR. If we look at both BVD and IBR together, abortions are the same, 13, 5, 73%. But if we look, 17% were positive, all 3 that aborted and 1 live calf for both either IBR or BVD, none of them in the killed, and 100% of them in the saline group. So their challenge was extreme. It was good enough that 100% of them had issues in the control group. But if we look, modified live or killed vaccine, no statistical difference here. Around 10% or less actually aborted. In the controls, it was 73%. So if heifers are set up correctly and we have a good program going into the herd, killed or modified live will give us good protections against abortions and PI calves for BVD. So we wanted, with some of the debate and controversy that was brought up with the first study, we decided to repeat the study. We used 10 herds, over 1,500 head this time, but we only did 2 treatments. We did a modified live or we did the combined killed BVD or temperature sensitive IBR vaccine and followed basically the same protocol. And so we can see here, but what we did different in this study was this was done on cooperator herds. And so all of these cattle were owned by cooperators, and we vaccinated them based upon how they normally vaccinated their herd. And so going through the chute, they either got a modified live or a killed vaccine, but they just got one dose of each. All of these herds had previously been using a modified live. Basically, every other animal got a modified live or killed. We did try to balance it, and we did on age, days postpartum, we knew that, but every other one within group got vaccinated, one or the other. The other difference you'll see is vaccination ranged from 89 to 27 days before the start of the breeding season. And so it wasn't exactly 30 days like we did before. And so if they were a heifer, they all got a second vaccine. So this would have been their second one to make sure they were vaccinated well before the start of the breeding season. What did we see for outcomes? We can see here the modified live had about an 8% decrease in AI pregnancy rates. At the end of the breeding season, there was no difference. But similar to what we saw in the first study, there's about a 5 to 8% decrease across all the studies we've looked at in that pregnancy success right after vaccination. And so there's always been a study that is looked at that has been referenced on, well, in well-vaccinated animals, there's no negative effects on luteal function. But when we look at this study, what we see is they saw no necrotic tissue. They saw no lesions following vaccination. These animals were set up with 2 doses of a killed vaccine and then given a modified live. But what we can see is animals that actually showed estrus activity that then had low progesterone at time of overectomies. So we can see actually 3 of the animals here. So we're looking at just under 30% of animals having abnormal luteal function. And so what we've been looking into after these 2 big field trials is what mechanism can be impacting reproductive performance. Because if we can figure out what the negative effects are, then we can start to build management programs that allow us to vaccinate at what's convenient and still maintain herd health in our herds. And so looking at that, we have focused a lot on the corpus luteum. And so Caitlin, who's a PhD student of mine, she's getting ready to finish up. One of her first studies was looking at, okay, are we actually getting the virus? And so if you look, we've done the same protocol on a lot of these studies. We synchronize, we vaccinate at what would be the beginning of the breeding season, even though we don't breed anything. And then we collect the tissues we need. So in this study, we did uterine flushes and biopsies on day 15 to half the group. We did follicle aspirations to collect follicular fluid and granulosa cells on day 17 from this group. We also had another 25 animals that we basically did what would be the next cycle, day 29, 30, and 31, based upon what tissue we collected. What's interesting, we looked at every tissue we collected. So uterine fluid and follicular fluid were all negative for virus isolation. Granulosa cells, we did uterine biopsies, so endometrium, were all negative for PCR results. So the virus was not found in any of those animals. But what did we see? If we look at progesterone, we actually had a group of animals, and it was about 10% of them, that had a modified live that had subluteal concentrations of progesterone. We also saw some differences in their titer concentrations when we measured antibody responses in those animals that had an abnormal cycle. And we can see their responses are different. This is the group, the dashed line is the group that had an abnormal cycle. And so we wanted to look further at the CL specifically and what we're actually seeing in the corpus luteum. Is there something we can see? And so we had another study following the same protocol, but we overectomized the animals. What we saw, 24% of the animals actually had an abnormal cycle if they were given a modified live. None of them if they were given killed. Now, all of these animals in the previous study and this one had all been receiving annual vaccinations with a modified live, and we still had 24% have an abnormal cycle. If we look at progesterone concentrations, we can see concentrations of progesterone in only the animals that had a normal cycle, or if we do all animals, it was lower. So it wasn't just these animals that had an abnormal cycle pulling this down. Even those that had a normal cycle, progesterone concentrations were lower if they received the modified live. And if we look at it daily or every other day as we were pulling blood samples, you can see the rise in progesterone comes up as higher. In the modified live, it follows the same pattern, but progesterone concentrations are lower. And so, as I mentioned, we had done overectomies on a subset of these animals, and we wanted to look at the corpus luteum to say, okay, the virus isn't here, but are we impacting it somehow? And if we look at this picture, we can see these large luteal cells again, just like was in the black and white one earlier. These large luteal cells are what's producing the majority of the progesterone. If we look at the group that got the killed vaccine, you can see this and see a huge difference between the control and a killed vaccine. We see all of these other cells. We can see the large luteal cells. They look healthy, but we see all of these other cells that have invaded the corpus luteum. What about with our modified lives? And if you look at these two pictures compared to the top two, you ought to be able to definitely see a difference. And what would have been the large luteal cells, you can see all of these kind of vacuoles. They look frothy. They don't look very healthy. And if we look at that, we can understand why progesterone production is actually lower. Is those CLs are not as healthy. We're actually impacting those large luteal cells. And so if we look at total number of cells, two students went through and counted all the cells in different sections of the pictures. We can see our control group, just over 200 cells. Are killed, we can see is way up here, about 450. And the modified lives are about 350. So there's more cells in all of our vaccinated groups. But what's interesting is if we look at the percent that is large luteal cells, our control is actually the highest. And so if you look at the cells that are there producing what we need it to produce, the progesterone, our control is the highest. The killed, because of all of these other cells that have invaded, is lower. And then the modified live actually have the lowest percentage of large luteal cells. So we are having a direct impact on the corpus luteum. Well, we also wanted to look at our cells living. And if we look, the blue here is actually any cells. The pink are cells that are dying. And what was interesting is when we overectomized these animals, we could get corpus luteum that had ovulated following the synchronization protocol. Those that short cycled and had a new corpus luteum forming had a new CL. And so that was only in the modified live group. But what we see is we don't see a lot of pink in these that did have a healthier CL. But any of them that had a short cycle and a new CL form, we can see this high level of death occurring, even though these are new CLs that are forming. Here's another picture of a new CL. We can see all of the pink in it. And if we compare that to a killed vaccinated animal, the CL, we can see very little. And so we can see how it's not only affecting that one cycle, but it's also continuing on in that next cycle or that next ovulation after a short cycle, impacting the corpus luteum. And what we can see is about 35% of the cells in these newly forming CLs were actually going through apoptosis. So with the virus not being able to be found, but we're impacting things, what exactly can be impacting it? And so one of the things that the body produces that can signal throughout are cytokines. And anytime there's an infection or anything else, we get upregulation of cytokines, and we know some of them can have direct consequences on the corpus luteum. And so if we look interferon gamma, we can see modified live normal versus an abnormal cycle. There's actually a difference. Interferon gamma protein 10, same thing. There's a difference between them. Some of the others, one of them that really stood out to us is this MIP1B. If we look, those that had an abnormal cycle, this cytokine was actually elevated for 22 days after vaccination. And so we're doing a lot of work looking at cytokines now and how what we're vaccinating, what cells they're upregulating to impact luteal function. And so we know that when we vaccinate, we can have negative consequences. When people ask me what is causing it, I don't have the mechanism yet, but we now have over 19 herds, over 3,000 animals that a modified live did result in decreased conception rates when given somewhere between 27 and 89 days pre-breeding. And so we're looking into what is changing in the body when we vaccinate an animal that is then disrupting luteal function. We know it's luteal function that's causing these decreases in pregnancy success, but we're trying to figure out what mechanism is actually causing it. And so the last thing I really want to address is the question I get asked the most is, when should I vaccinate? We know we need to get replacement heifers on a good program. We know we need to get them established around weaning, give them a chance to get them vaccinated before they move into the herd. When we look at the data and what I'm going to show you, I actually recommend at least 45 days pre-breeding for that last vaccine. And the reason I say that is the timing of follicular development. And if they're a modified live, we probably need to be much further than that. Or if it's a modified live in a naive animal, we need to be much further than that. And so if it's a naive animal, we need to be discussing things well before the start of the breeding season. But when we go through, and we've actually are working on a larger study right now, but this is the 1,500 head, or over 1,500 head that was in the producer study, that we vaccinated anywhere from 27 to 89 days pre-breeding. And some of the herds in this study, what several of them did, was they vaccinated. They're in South Dakota, a lot of times people are calving in lots. And so when they move them from a lot out to grass, they will vaccinate them so they don't have to bring them back in. And so we actually within herds had that variation, and we're working with a couple of herds now that we have the same thing. We have wide spreads within the same herd, same management of when things are vaccinated. But if we look, the killed vaccine was higher than the modified live across all of them. But within either group, whether it's the killed vaccine or the modified live, when we get out here greater than 45 days, we see this increase in pregnancy success. And so based on that, that's allowing the body to get over things. And if we go back to this cartoon I had up earlier, we've known for years that these viruses like getting into this dominant follicle. And the fluid that forms the antrum in these follicles actually starts back here. And all it is a filtration of serum, blood serum. And so if it can get into here, there's no reason to think it wouldn't be getting into these also. And so from this early antrum formation until ovulation is 42 days. And so that 45-day period allows us to get over any follicles that had an antrum formed before the start of the breeding season. And therefore, hopefully get over any negative consequences. There is a dairy study that had several hundred head in it that actually compared a modified live to a killed vaccine where they vaccinated 45-day pre-breeding. And with several hundred head, there was no statistical difference between these two treatments. And so that's kind of why I lean to 45 days. And so if we think about it, we know that modified live vaccines have the potential to negatively affect, because that virus, when we give that modified live, that virus comes in, starts replicating in the body, even though it is dropped down, it's not like the true infection, but we do upregulate the immune system very differently than we do with a killed vaccine. We know that adverse effects can happen. We know there's variations from herd to herd with exposure and other things. Heifers, we need to get set up early in life. The one study I showed you between the modified live and killed on abortions, they started setting those heifers up with, all of them got a modified live around weaning when it's safe. There's plenty of time to get over negative consequences before the start of the breeding season. And then they moved them to a killed vaccine when they got into the breeding herd. We know modified lives have a better cell-mediated immunity. Killed vaccines give us a better antibody response. And so when we booster with it, we give that big boost with a killed vaccine, and we get that big boost in antibodies. You need to be visiting with your local vet, because as I point out to people, okay, I'm in Overton. I don't know your neighbors. I don't know what's going on. Your local vet is the only people who are going to know what your neighbors are dealing with too, because viruses are not reportable diseases. And so they're the only ones who know what your exposure levels might be. But we really focus on reproduction when we're dealing with the cow herd. And more specifically, we know IBR and BVD, not only the fetal losses and pregnancy losses, but we can actually negatively impact the ovary and estrus cycles. And so with that, a lot of people to thank, a lot of collaborations, all the grad students who really did most of the work, and the companies that helped fund all of these studies. And with that, I would be happy to answer any questions.
Got any questions? Hang on, Houston. I got to give you the mic. Hang on.
When would you use a modified live virus? When is that preferable to the killed viruses? What application?
So there are situations that are more risky. Modified lives are used tremendously in feedlot animals, and that where animals are coming in commingling. You don't know backgrounds of animals, because you will get that bigger immune response immediately. And so I know of some situations where people are running stocker cattle and their cow-calf cows through the same facilities, their fence line contact. Those situations are, I know some heifer development centers that are trying to get modified lives in very early. We worked with a heifer development center a few years ago that unfortunately they were getting cattle in. People were sending them cattle from a sale barn, and they ended up with BVD exposure, and it hurt conception rates. But fortunately, due to the vaccine protocols that were used, none of the calves born were PIs. So the vaccines worked at herd conception rates. And so to me, it really is a matter of the situation you're in, the biosecurity level, and the level of risk that things are put in. In a good biosecure cow-calf operation, right now, and the immunologists that I do work with and stuff that do a lot more on that side of things, the best recommendation is getting modified lives into heifers around weaning, getting their immune system set up that way, building good memory cells. And then when you get pre-breeding and into your breeding herd, doing your annual boosters with a killed vaccine, because there are much safer times to look at things. We've got, like I said, a large study going on right now with multiple cooperators that we're looking at how far out we can go. So we've got some animals that are vaccinated 6 months before the breeding season, all the way up to the label of 28 days within the same herd. And so we'll be able to compare their both modified live and killed and see if there's some timings that do work better in different situations.
Thanks. Any others? Well, thank you, Dr. Perry. We appreciate you zooming in and sharing your time with us, and we'll move on. Thanks again, George.
Sounds good. Thank y'all. Have a good day.
Uh-huh.